Good morning, everyone. Welcome to the Penn State College of Medicine COVID-19 Echo Series. We're delighted to have you join us for another session. My name is Jackie Sable. I'm a member of the Echo team, and I'll be facilitating today's session. A few quick announcements before we begin. If you've not already done so, please put your name, email address, and affiliation in the chat box. We ask that you stay muted unless you're speaking. If you dialed in, you can use *6 on your phone to mute and unmute. And if you're on a computer, you can use the microphone icon on the bottom left-hand corner of your screen. We realize that question and answer time is important to you, and we're trying to categorize and address as many questions as possible. So if you have questions, please feel free to put them into the chat session. After today's lecture, we'll have a few moments for some Q&A, then we'll go into our discussion and also have some follow-up questions then. If you have questions that are not answered, we'll either follow up via email, or you can submit unanswered questions as case discussion items for future sessions. Please remember that no personally identifiable information is allowed. We are recording these sessions, and we share all materials and recordings after the session. In the spirit of all teach, all learn, we'll be on a first name basis during our sessions. Our echo sessions always begin with a brief lecture followed by a case. So cases usually contain a question or a challenge. And again, we encourage you to submit cases which can be related to patients, preparedness, policy, any challenges that you're having in the COVID-19 crisis that would help generate discussion and ideas. For today's session, Dr. Ping Du will be discussing the current pandemic and public health measures for COVID-19 control. We'll then hear from Pastor Tony Fields, who will be sharing a case regarding what local organizations can do to maintain a sense of community while still maintaining social distance. During the lecture, please feel free to put your questions in the chat. We have a team of specialists from Penn State online. They help to field questions. But remember, this is an all teach, all learn environment, so anyone can share both questions and answers. With that, I'm going to turn things over to Ping for our brief lecture.
Good morning, everyone. So today I'm going to introduce public health measures for COVID-19 control. And since we are all staying at home now, some people don't understand why social isolation or social distancing is important. Actually, let me tell you one thing. On March 11th, I emailed my high school daughter's principal asking him to cancel high school concert, because oftentimes for high school concerts, there are several hundred people in the same room, and he couldn't make a decision. He actually forwarded my request to the superintendent, but the response from superintendent was there was no case in our community, so there was no need to cancel the event. I was surprised to hear that, because at that time there were already community transmissions going on in Pennsylvania, but apparently we were not prepared. So that's why I think it's very important to educate the general public about infectious disease transmission dynamics and why we're doing social distancing now. Okay. So this shows current status of COVID-19 as of April 2nd. However, this morning when I checked the number, and there are already over 1 million cases worldwide and over 55,000 deaths. And certainly this is not something we want to see. And often people think for respiratory infections, humidity and temperature will change the situation. But when we look at map, and certainly we can see that countries in Northern Hemisphere hit hard by the disease. But when we look at countries in Southern Hemisphere, there are many cases as well. So currently over 100 countries reported COVID-19 cases. So apparently this is a very tricky virus. Seems the humidity and temperature may not work. So that's why we don't expect that when summer comes, when temperature and humidity increase, we would expect decrease in number of cases. And also when we look at daily increase rate, So if we compare number of cases day by day, and for many countries, we're still seeing increasing daily numbers. And when we look at what's going on in the United States now, next slide. So the first case of COVID-19 was reported on January 22nd in the United States. It was a travel-related cases. But if you think about 2 months later, and there were over 200,000 cases and over 5,000 deaths in the United States. And also, if you think about population density and contact intensity, not surprisingly, we see many cases in big urban cities. But from this map, you can see the disease is already widespread, not just limited to those large urban centers, even rural communities affected by COVID-19 as well. So that's why we have to take actions. So we can prevent more cases and also prevent more deaths from COVID-19. And another interesting observation for cases in the United States is that at the right-hand corner, and when we see daily increase in the United States, so we can see from January to early March, the curve was very flat. So we barely see any major increase because at that time there were mainly travel-related cases. There was no significant community transmissions. However, due to the lack of responses and eventually community transmission occurred. And all of a sudden, we see daily increase at a rate of 15%, but recently we see daily increase at 30%. So every day we see 30% more cases. But this is a very urgent health issue and we have to take action now. So what's going on in Pennsylvania? And now you see how the disease is spreading in Pennsylvania by counties. So in Pennsylvania, and our first presumptive case was reported on March 6th, and it was a travel-related case in Wayne and another one in Delaware. Both of them had travel history. So at that time, there was no evidence of community transmission. Then think about a month later, and we got, well, I just checked the number. We got over 1,000 cases and 90 deaths in Pennsylvania. But certainly, when we look at epicenter of COVID-19 in Pennsylvania, and counties near Philadelphia region hit hard, but apparently the disease is spreading to other counties as well. So in response to COVID-19 in Pennsylvania, and the governor just ordered stay at home. And apparently we have another month to see what's going on in Pennsylvania. Hopefully we can slow down the pace of the disease and eventually control COVID-19 by the end of April or early May. So what would happen in the future? Nobody knows because we don't have a crystal ball to predict the future. However, we do have infectious disease modelers to predict the trend of the disease and also what would happen under different intervention scenario. So on the left hand, the figure shows a predicting model by Imperial College. So basically, the bottom right line represent critical care bed capacity. And under different infectious disease control scenario, for example, do nothing, case isolation, isolation plus quarantine, school closure, and then all together, and we would expect impact on our critical bed capacity. So basically, if we didn't do anything, and eventually our healthcare system would be overwhelmed, and you see our curve increase so suddenly, and apparently compared to the right line, and you see big peak coming fairly quickly. And even we do closing school and isolation or combination with case isolation plus household quarantine, you still see the big jump of the curve. So apparently, without very strict or very aggressive public health measures, and our healthcare cannot handle the increased need for critical bed or ICU. And another modeling work just simply compare number of cases between United States and Italy after the onset date of the cases. It seems like in the United States, we're following the pace of what's going on in Italy. And considering the size of the population in the United States, and eventually we may see a lot more cases and more deaths. This is something that we don't want to see. And right now, United States is the #1 country with the most COVID-19 cases. So if we take action now, and we can reverse the curve. Next slide, please. This is another model created by IHME. It's also known as the White House model. So basically, White House uses this model to direct next actions. So this model, again, predict healthcare capacity. So basically, the purple dashed line represent all beds needed to treat patients, and green line represent ICU beds needed, and blue line represent invasive ventilators needed. So according to this model, and the peak of the resources need will reach by mid-April. So we have about 14 days left. And certainly compared to our current healthcare capacities, we cannot handle that. And even with public health measures, and still, can we handle healthcare needs? We don't know. And according to this model, by August, and there will be over 80,000 deaths. And over time of this outbreak, there will be 100,000 to 240 deaths. So that was the predictive model by IHME, and certainly this model was well acknowledged by the White House. So that's why our country is taking more aggressive measures now. Next slide, please. But why is COVID-19 so contagious? And how come the disease spread so quickly, and all of a sudden there are so many cases and overwhelm our healthcare system? Then we all need to understand the basic infectious disease transmission model. So according to current evidence, R0 for COVID-19 range between 1.4 to 3.9, meaning one infected individual can infect up to 4 more new cases. So when we look at the general disease transmission dynamics, we need to think about how the virus replicate and also how the virus affect human bodies. So basically, this figure just tell you 2 information. So on the top, it shows how people become infected from susceptible stage to infected stage, and they become infective and eventually either recover from the disease or die from the disease. So basically, if we assume that people, after people being exposed and they got infection right away, but at the beginning of the infection stage, and the virus need to replicate in the host body. And once the amount of viruses reach a certain threshold, then the infected individual will become infective, meaning this individual is able to transmit the disease to other people. And the viral load continue increase until host immune function kick in. And eventually our immune response will be able to control the virus. And then you see viral load gradually decrease over time. And after our antibody response kick in, and eventually the virus will be cleared from our body and people recover from the disease. And for some people, if they cannot recover, and eventually they will die from the disease. So this curve represents changes in the viral load in the host body. So clinically, and we cannot detect the viral load often, and we rely on symptom detection. And after people are infected, and during certain period of time, they did not show any signs and symptoms, and we call this incubation period after the infection. But once the viral load reaches a certain level and also cause damage to the body, and eventually people will show signs and symptoms. We call this symptomatic stage. So the tricky part about COVID-19 is that this virus causes large proportion of mild illness. So about 80% people infected with COVID-19 virus only shows very mild signs and symptoms or atypical signs and symptoms. And oftentimes we cannot distinguish those symptoms from common cold or from influenza. So those mild cases may not be captured by the healthcare system. So they remain as an infectious source in the community and transmitting the disease to other community members. And the rest, 20%, may develop more severe illnesses and or even critical conditions, and they will need to seek immediate health care and be hospitalized. So the blue curve shows changes in antibody responses, but certainly at the beginning of the disease course, there was no antibody response. But oftentimes after 7 days of symptom onset, antibody level gradually increase. And eventually when the antibody level are high enough, and we're able to control the viral infection. And so this curve also gives you some very interesting findings about this virus. So basically, the incubation period ranges between 4 to 14 days, meaning within this time period, people are infected, but they do not show any signs and symptoms. And also for our PCR detection, and the viral load need to reach certain threshold so that people can become detectable, so that their disease or infection status can be detected. And so it takes time for the virus to replicate and eventually for the host to become detectable. So according to current evidence, it seems like after the infection, and people can shed the virus as long as 37 days. So during this 37-day period, and we can detect infection using PCR technology. Another important part is about infective period. It's a time interval when the infected individual can transmit disease to other people. We are not so sure how long the infective period lasts, and oftentimes people think maybe 5 days or even longer. But there's a very interesting period in this shaded blue area. So during this period, people are still in the incubation time, and they're infected, but they do not show any signs and symptoms. However, during this period, they can be infective, meaning they can transmit disease to other people without showing any signs and symptoms. And how long does this period last? We're not so clear, but according to current evidence, about 1 or 2 days, people may already become infective, but they do not show any signs and symptoms. So that's why this virus is so tricky, and also the disease is so contagious, because by theory, people can transmit disease to other people before they show any signs and symptoms. If you think about somebody showing up at work, do not have any signs and symptoms, but they are able to shed the virus and infect other people. So this is a very important message to our public health control measures. And we also got some early evidence about asymptomatic transmission either during incubation period or during pre-assumptive treatment period. So basically, from the early evidence studying how disease is transmitted between family members, but this work was to assess disease transmission between 4 family members. So basically, in this family, there are 2 sons, and these 2 sons lived and worked in Wuhan. And before Chinese New Year, they came back home and to meet their parents. So when they arrived home, they did not show any signs and symptoms. But about 5 days later, their father showed poor appetite and dry cough. So this father has underlying disease, and oftentimes he did not go out. So there's no contact with outside people. So the father showed signs and symptoms first, but 1 day later, one son showed signs and symptoms. So it's kind of interesting because if you think about two sons lived in Wuhan, they exposed and they may be infected, but when they arrived home, they did not have any signs and symptoms. But their fathers showed signs and symptoms first. And several days later, their mother showed symptoms as well, and they were both hospitalized. So this familial cluster showing possible asymptomatic transmission during incubation period. Next slide. So another evidence studying viral load at time of onset and also during the disease course, also indicating high viral load right after onset of the symptom. So if you look at the figure, y-axis represents the count value. The lower the count value, the higher the viral load. So we can certainly see the viral load is highest right after the onset of the symptoms. However, for this study, since there was no data about viral load prior to symptom onset, so according to theory, viral load cannot start from zero all of a sudden to a high level. There must be a gradual increase. So it's very likely that people already shed virus before symptom onset. And certainly after symptom onset, they're more likely to seek medical care and be captured by our healthcare system so that we can collect samples from them. But if we think the viral load is highest at the time onset, and it's very likely that people already shed high level of viral load before the symptom onset. So after symptom onset, then we can see gradual decrease in the viral load. Next slide. So currently, there's no effective treatment. Although some clinical trials are going on, some observational studies suggest a certain treatment may be effective, but so far no effective treatment has been identified. And the vaccine trial just started, but oftentimes it may take up to 18 months to study the efficacy and safety of any new vaccines. So apparently there are no effective pharmaceutical interventions now, and we will have to rely on supportive treatment. But for supportive treatment, and we will need to make sure that we have sufficient healthcare capacities in response to the increased need for hospital bed, ICU bed, critical care, and ventilators. So that's why flattening curve method is very important. So basically, if we don't do anything, and eventually we will see peak demand for hospital bed, ICU bed, ventilators pretty soon. And all of a sudden we see many cases that need critical care, and certainly this will overwhelm our healthcare system. But if we can reduce daily number of new cases, and we can prevent our healthcare system from being overwhelmed. So that's why we call this approach flattening the curve. So the goal is to reduce daily number of new cases so that eventually we can make sure that our healthcare system has the capacity to care for sick patient need critical care. But the question is, without effective treatment, without effective vaccine, how can we flatten the curve? Then we'll need to rely on non-pharmaceutical interventions for disease control. So oftentimes for any infectious disease control, and we'll need to think about the level of the cases so that we can develop either containment plan or mitigation plan. And so for containment plan, at the early stage of transmission, when there are only a limited number of cases, oftentimes travel-related cases, no apparent community transmission, we can contain the disease at early stage. So basically, our goal is to prevent or slow the of local transmissions of the disease. So we'll need to take aggressive approaches to isolate infected individuals and to quarantine exposed people. And meanwhile, we'll need to enhance our testing and treatment capacity and also educate the general public to improve personal or environmental hygiene. Next slide, please. So there are different approaches that can be conducted during the containment stage. But just remember, the goal is to reduce the pace or prevent any possible local transmissions. So oftentimes, we'll need to isolate the infected individuals and also conduct aggressive contact tracing. So what is contact tracing? So basically, for a confirmed case, and they'll be interviewed to name or to report possible close contact that may be exposed to the case. So basically, public health disease intervention specialist or a hospital employee or healthcare providers, they will interview the case to obtain their contact information. Then they will reach out to the contact to evaluate their risk, just to see how likely they're exposed to the disease. And they, for contact already show signs and symptoms, and certainly they will need to be tested or be monitored for possible disease occurrence. And so ideally, we want to test all contact that to make sure if they're infected, and they will be isolated immediately so that we can remove them from being infecting more people in the community. So for contact tracing, it helps us to find more cases quickly so that they can be isolated, and also exposed contact can be quarantined so we can interrupt the disease transmission in the community. But because contact tracing is expensive and also labor intensive, that's why we will need to think about multiple sources to help us conduct contact tracing. And oftentimes, contact tracing is conducted by the public health department, either local or state health department. But because of limited resources and also lack of sufficient staff, so for hospitals, and they need to work with their employee health, or maybe work with their medical school or other stakeholders to think about contact tracing plans, because finding exposed contact is very important to interrupt disease transmission at early stage. And we also need to start to enhance our testing capacity and prepare to increase treatment capacity, and also developing infection control plans, especially at high-risk settings like hospital, nursing homes, or long-term care facilities. And we need to start social distancing right now. Although there are only a limited number of cases, we have to start it right now. And it's always important to avoid any so-called super spreading events. And you may see the news about a choir group decided not to cancel their rehearsals. And a month later, so many members in the choir group become infected, and 2 of them even died. So that was very tragic event that could be prevented. So that's why it's always important to initiate any effort at early stage so that we can prevent new cases, new transmissions in the community as early as possible. And certainly we need to educate the general public to make sure that they understand the severity of the disease and also understand the importance of those public health measures. Next slide, please. But if there's evidence showing widespread transmission, community transmission, and certainly we'll need to think about mitigation plans. The goal of mitigation is to slow down community transmission and also to minimize mortalities in the general population. So the goal is to reduce population density and contact intensity using social isolation or social distancing too. And meanwhile, we have to enhance our testing capacity. We need to think about massive testing strategies so that exposed individuals, those close contact or even casual contact need to be tested so that we can identify as many cases as possible in the early stage. And meanwhile, we also need to continue enhancing personal or environmental hygiene. And so regarding patient treatment, since there are already widespread transmission and we may see more cases, but our healthcare system cannot handle all those cases. And we have to triage patients based on their symptom levels. So for mild cases, and so they can stay at home and watch their signs and symptoms. So ideally, they should be put in a centralized place with medical staff and the necessary medical equipment on site so that they are cared by the medical professionals. And for severe cases, and they will need to be hospitalized so that we can prevent our healthcare system from being overwhelmed, so we can focus our effort on treating severe cases. And meanwhile, we also need to conduct more research to develop new drugs or test new vaccines, and also provide more medical or supportive services. So we will go over all the details. So basically, during the mitigation stage, we'll need to rely on non-pharmaceutical interventions. But oftentimes, we need to use a combination of different strategies because there's no a perfect strategy. We have to think about multiple ways. Strict social distancing guidelines are very important. And oftentimes, for the general public, it may be difficult to stay at home for 14 days without going out, but we have to make sure that people are following social distancing guideline. And we have to enhance our surveillance and screening capacity for early detection and early diagnosis, and conduct aggressive contact tracing. Although contact tracing is labor intensive and time consuming, but very important to identify cases at early stage. But if you think about right now in the United States, in most areas, our testing is still risk-based testing. And oftentimes for people with travel history, with exposure history, or relevant signs and symptoms, but we have to expand our testing capacity so that we can detect asymptomatic cases or pre-symptomatic cases, and we can prevent transmission at early stage. But right now, as of March 28th, our testing capacity is increasing, but it's still not optimal. The overall testing positivity rate is about 15% because we're using risk-based testing, so we focus on high-risk individuals. So that's why our overall testing positivity rate is higher. So if you think about if you test 100 people, 15 of them would be positive. So that's a very important message. As far as for contact tracing, since our health departments overwhelmed in response to COVID-19, and the contact tracing will rely on healthcare facilities themselves. So that's why we'll need to think about innovative strategies for contact tracing, and also early isolation for confirmed cases and quarantine of those exposed contacts. So ideally, some centralized places would be ideal so that those confirmed cases with mild illnesses can be put in a place with medical staff on site to monitor their signs and symptoms. Because according to China's experience, and if we let people do self-isolation at home, and most of the time, the whole family members will be infected. And sometimes people must to go out to get their food and get their household supplies. That also increases the risk of infected individual get in contact with community members. So that's why early isolation is important. And we also need to think about feasible and effective strategy for early isolation as well. And good personal hygiene is always important. And if it is necessary, we need to conduct environmental disinfection, especially at some high-risk facilities. So routine environmental disinfection or infection control is also very important. And we have to do more research. Certainly we can do simulation work or modeling to guide our intervention efforts. And we also need to think about novel technologies for contact tracing. And meanwhile, we have to accelerate our drug development and vaccine development during this stage as well. So I'm going to briefly introduce some non-pharmaceutical interventions at different places. And you all know the disease started in China. And so the first presumptive case was actually reported as early as November 2019, but the confirmed case was detected in December 2019. So that's why the disease was named COVID-19. It was already end of 2019. And so Wuhan was the epicenter of this outbreak. And when the number of cases was only several hundred, and Chinese government ordered Wuhan lockdown. And also at that time, very strict social distancing and move restriction were put in place, not only in Wuhan, also in other cities, and eventually nationwide move restriction and lockdown. And also at that time, multiple special COVID-19 clinics were open just to try out patients with relevant signs and symptoms, so that those presumptive cases don't get in touch with other patients and infect other patients as well. And early quarantine and isolation was were put in place as well. So for the left hand, it just shows changes in number of reported cases in China. And so if you can see Wuhan lockdown happened on January 23rd, 2020. About 2 weeks later, often one incubation period of COVID-19, and there's a decrease in number of case reports. So oftentimes for any public health measures, you will need to wait at least one incubation period to actually see the effect taking in place. But think about what happened in China. It's not just social distancing or move restriction. It really involved multiple efforts. So for the photo on the right-hand side, it shows so-called makeshift hospital. It's a centralized place to isolate mild cases, so that those mild cases are put in this so-called makeshift hospital, and a special medical team with physicians, nurses, and the supportive staff on site to monitor the symptoms and also to track their PCR viral load. And for people who are recovering well after 2 positive PCR tests, after fever-free for 3 days, symptoms and signs improved, and they can be released, but they still need to do another quarantine for 14 days. And for people with worsening symptoms, they will be transferred to designated specialty hospital to treat COVID-19 patients. So with this early isolation effort, and also isolation at a centralized place, and those mild cases are removed from the community so that we can prevent community transmissions from those mild cases. Next slide. So South Korea provided different experience. So they conducted massive screening for early detection and very aggressive contact tracing to isolate and quarantine exposed individuals. So basically, right after there was reported cases in South Korea, and South Korea conducted massive testing. So on the left hand, you see the figure of changes in number of reported cases in blue bar, and the red line represents daily number of COVID-19 tests, and blue line represents cumulative cases. So with aggressive testing in place, and more cases are detected, and eventually those cases were isolated, and exposed contact were quarantined. So with this approach, after one incubation period, and we start seeing decrease in number of confirmed cases, and even with the increased number of daily tests, the number of COVID cases continue decreasing, showing effectiveness of this massive screening and also contact tracing approach. And on the left-hand side, this shows the aggressive contact tracing conducted in South Korea. So basically, South Korea COVID-19 emergency response team used novel strategy to conduct contact tracing. So basically, they developed an app, and they also use GPS tracking, and they linked their medical records and even bank information to identify possible contact, exposed contact of confirmed cases, and evaluate the risk for each contact. So for close contact, and certainly they are ordered to stay at home. So it's a public health order for move restrictions. They have to follow the order. And meanwhile, they are monitored for signs and symptoms. And for casual contact, there's no move restriction order, but still they are watched for signs and symptoms. And also later, they're all tested. So with this aggressive approach for contact tracing, and eventually disease at early stage can be detected, and so that further community transmission can be prevented. So with the massive screening, aggressive contact tracing, and you can see even without nationwide lockdown, and eventually the daily number of cases continue decreasing. So for Korea experience, just provide a very good model how early or massive screening and contact tracing works. Another important finding from Korea experience is on the next slide. So basically, from the massive screening, we can understand the overall positivity rate in the population. So since many people are screened in South Korea, and some people are exposed, they have certain risk, and some people do not have the risk, so that we can understand the overall positivity rate in the general public. So the I think the highest positivity rate at some point was about 4%. So meaning in the general population, maybe as many as 4% are infected with COVID-19, but some of them may not ever show signs and symptoms. So when we look at age distribution of COVID-19 cases in South Korea, and we also see some very interesting findings. And so apparently this disease hit young people, and we see a lot more cases in age 20 to 29 years. And when we look at a death rate in this age group, 0%, meaning it's very likely they have mild illnesses. But because young people count for a large proportion of the total population in South Korea, and if they are infected, if they do not show signs and symptoms, and certainly they can be important transmitters of the disease and transmit disease to older people in the community. And when we look at death rate by age in South Korea, and certainly for elderly people, and if they're infected, and oftentimes they're more likely to develop severe illness and also die from the disease. So this information is very important. First, it tells us what is the infection rate in the general population, and second, who are the high-risk group that transmit the disease to the community. So with this information, it just gave us the basis for massive screening, we have to identify asymptomatic cases in the community so that we can prevent future community transmission. Apparently, young people, maybe adolescents, they are important transmitters in the community. And also, we'll need to better understand asymptomatic or pre-symptomatic transmissions. And now we have more and more evidence to help us gather more information. So on the left hand, it just shows viral load by onset time. So basically, it just supports that viral load is highest at the time of the onset. But again, we don't have much data on viral load prior to onset. And also for, if we compare viral load between mild cases versus severe cases, they all share the same amount of the virus. So it doesn't matter if people have mild condition or a severe condition, they all share the virus at a similar amount. So that provides important information because according to this article, if 44% of the transmission could occur before symptom onset, and this certainly tell us we need to take more aggressive disease control effort because we'll need to identify those asymptomatic cases so that we can reduce substantial presumptive transmissions. And on the left-hand side, another study compared the serial interval of COVID-19. So serial interval represents time between the symptom onset. So oftentimes we compare the time of onset of the primary case, the case that brings the infection, and then the symptom onset of the secondary case, the case who got the infection from the primary case. So if the difference between symptom onset is negative, it means that primary case developed symptoms later than the secondary case did. So from this figure on the left-hand side, you can see about 13% of primary cases develop signs and symptoms later than their secondary cases. So that is a good indication of presumptive transmissions. So for primary cases, they already infected, but they did not have any signs and symptoms. Instead, they infected other people. And after other people develop signs and symptoms, and they develop signs and symptoms. So that's a very important message to help us understand asymptomatic transmission.
Ping, excuse me, this is Jackie. In the interest of getting to a few questions and our case, can we jump ahead one more slide? I'd like to ask you to quickly go through kind of the public health measures and your input on masks, and then we have some questions and I'll then turn it over to Tony.
Sure, okay. Yes.
Thank you.
Mm-hmm. Okay, and now we're all conducting more strict social distancing, and sometimes we have to think about move restriction. It's always important to remind people about good personal hygiene. Washing hands is always important, and it's a very simple approach. And sometimes we have to conduct environmental disinfection for infection control as well. So for next, we'll talk about if we should wear masks. So why do we need to wear masks? So the goal is to reduce R0 so that we can prevent further transmission and also protect high-risk individuals. And if you think about for people live in high positivity areas or high disease areas like New York City, and certainly their risk of being exposed to an infected individual would be very high. And wearing a mask is helpful to prevent them from being exposed to infected individual. And meanwhile, for asymptomatic cases, and they may not be aware of their infection status, wearing a mask and certainly would prevent them from shedding virus or infecting other people. And we also need to protect high-risk individuals like healthcare workers, elderly people, people with underlying disease, or employees who are more likely to be exposed to other people, like grocery store employees. So this figure just show how masks can protect people from either getting infected from other people or shedding the virus to susceptible people. However, right now, we really don't have a good answer for that. In my opinion, if you want to wear a mask, go for it. But we certainly need to reserve masks for high-risk individuals. We don't want to take resources away from those people, from vulnerable people, and we need to protect them. So that's my understanding. But I know for many countries, they are considering asking their citizens to wear masks. So, but in my opinion, we cannot take resources away from high-risk individuals that we want to protect.
Thank you, Ping. Excellent points around masks. I'm going to ask, I think we have a few of our panelists online. I think we have Gavin, William, Rebecca, and of course you, Ping. If you can see the chat, there are 2 questions that maybe you can respond to in the text while I go ahead and get Tony going with his case. So one question from Maria was, does anyone have information regarding asymptomatic, minimally sympatical patients developing high levels of protective antibodies? And then somebody else was under the impression, I think it was Jeffrey was under the impression that there's still uncertainty regarding the development of immunity. So I would ask if the panelists have anything to respond or anyone else online, please put that information in the chat so we can capture it. And I'm going to turn things over to Tony so he can tell us a little bit about what he's doing in terms of engaging the community at a distance.
Me, okay, thank you for inviting me. We're glad to be here on this occasion. One thing that we're doing is we have changed out the way that we worship. As the pastor, what I'm doing is I'm calling each member from our directory. You may know this, but I have 2 churches. So we have directories, and I'll call each member every 2 weeks just to check on them, see how they're doing, let them know that the church is still there for them, as well as the pastor is still there for them. And so I think it's important, especially in this time with everything that's going on, to remind them that we care for them, that we are praying with them. So I talk with them constantly. Then my governing bodies, where we have different governing bodies for the church, we have our Zoom chat. And so we have about 5 different groups. And each week we meet and we talk and we chat. And just to see how, one thing I want to do is see how the leaders are doing. They check on them and see how they are doing and their family. And then also the governing body to see how they're doing. And then my job, well, I want to deploy, but I want them to go out and I want them to call their members and call the church as well. So not just me, the pastor, that's calling, but also the leaders are calling the members weekly so we can find out how everyone is doing and remind them. And then what we do is weekly, I do some Facebook postings just to chat so they can see and talk and say hi. Also, I'm aware that several of my members do not have Facebook. So that's why it's important that I call and chat and talk with them. But I have Facebook posting, I do Instagram posting, so just to stay in contact with the community and to engage with our members. But for our Sunday services and our midweek services, we do mail our bulletin to the members so they can go along when we have our Facebook chat. So it could be like a flow of being in worship services and stuff of that sort. So we do mail out our bulletins, the weekly services. My choir director from Christ Church, he put on our Facebook page, he put pictures of everyone in the pews. And he did a video and this song called Go Light Your World. And then he played it so you can see each person that's in the pew as though I'm really talking to some, the individual, and people can also see those kind of things that's happening. And so those are just some of the things that we're doing. We are also trying to be creative. It's funny, but it's not funny, but to do different clips. I was out in a tutu and trying to do a little dance just to say hi to people and our members, to try to keep everyone encouraged, especially in this time. And so Now we're not doing any services um, at the church. We'll be doing them at home now because of trying to maintain and keep everybody home. So also it's important for me to be safe as well. So now our services will be done here at home. And it's going to be a challenge, but this is something that we're going to do. And then also every day I go to the church and I ring the bell for our noonday prayer of the Lord's Prayer. So I ring the bell 12 times for the city, for the county, for the area in Annville, just to remind them that we're still praying with them. And then what also we did, we mailed palms. This Sunday is our Palm Sunday. So we took the old palms that we had from last year, and we just cut little strips. And then when we mailed the bulletins, we also mailed the palms. And so we're going to ask them to share the palms as though we are in a regular worship service. And another thing that we're doing is for Easter, since Easter will be canceled, I'm asking everyone to have crackers or pretzel or bread or wine and juice or water. And then we'll be celebrating communion also in that way together. And so we'll be setting out a block time to share in those occasions. And then it says the community, we have donations that we're doing. We had a blessing box that we have in our communities. And so we are prepared, we are putting food in the blessing box for those who are going through the time of food insecurity, that they can go and get food out of the blessing boxes. So we've been filling about 2 or 3 times a day to make sure that our communities are healthy. Then also our church, we send out 15 pizzas and 15 large salads to the hospital, because our nurses and doctors are really being challenged this time, but we want them to know that we care about them as well. So those are some of the things that we're doing to try to help address this COVID-19.
So thank you for that. I mean, it's obvious your care for your community. I'm a little disappointed we didn't see the tutu clip, but that's okay. So does anyone have any, we have 1 or 2 more questions that are related to Ping's talk, but does anyone have anything regarding other strategies that are being used for organizations to still have this community but be distant?
This is Becky Bascom. Some of the things, Tony, that you described that sound really important are the fact that some of these activities are pegged to a specific time. So ringing the bell at noon. One of the things that happens to people with this in this pandemic is there's the loss of structure. And the fact that you connect a schedule to the sense of community, I think is very wise. And so I'm not at all surprised that that's successful. I'm part of a group of people who have pulmonary fibrosis. I'm a physician, and we have a monthly support group meeting, which we obviously can't have at the moment in person. And we decided to have it in a Zoom setting last Monday. A lot of people had never been on Zoom. It was very awkward at first, but people were absolutely delighted to see each other. So I think some of your communities within your congregation of parishioners could also get on Zoom and connect with each other. I don't know if there is a women's group or a Sunday school. So I encourage extending the use of Zoom to maintain the community, not just among the leaders of the parish. The final thing is people with pulmonary fibrosis absolutely need to exercise, and that's been very difficult. People have had trouble creating that structure for themselves. And so here we were at our support group talking and joking, and then everybody got up and did their exercises. And people realized, and then everybody showed each other their pulse oximeter to make sure their oxygen level was safe. And so I think that kind of doing a specific activity that group has engaged in is another way of fostering community. The final thing I would say is that you're mailing things out. Paper does not seem to be something that transmits virus. And I'm sure you're quite careful about that the person who's doing the envelopes and all is someone who's well. So I think that does tend
Yes.
to be safe. But anytime you're connecting physically something with somebody else, there's a pause to make sure that that's not something that's a source of transmission. I think you're fine in that regard.
Thank you for that. Thank you so much, Becky.
Thank you.
I think
One
Eric,
thing I want to add is that, thanks Tony and Rebecca. So we call this social distancing. It's actually physical distancing. We're still socially connected and we still find ways to communicate with each other, either through Zoom or our Facebook, social media sites. So all we really need to change is to physical distancing, not social distancing, because we're still socialized.
Yes.
one of our past presenters, I don't remember which one, used the term we are distant socializing, and I think that's key. One last question related to testing, if we can get to that. Does anyone know the status, the state of testing in the U.S.? Where are the barriers to widespread testing? And if we don't have an answer now, we can share that out afterwards.
We just don't have a lot of reagents at the moment. That's the limitation. So there's clearly more and more testing being available, but even the places where they're having so at the medical center, there's testing with short interval, but the reagents are still limited. So I think eventually widespread testing will be possible, but at the moment, unfortunately, there still has to be choices as to who and when to test.
And I also heard that we're short of testing swabs as well.
Yeah.
Okay, thank you for that. So we will go through the questions that are in chat that weren't addressed and try to find some follow-up answers for you, as well as sharing some of your strategies for engaging your communities. A reminder that you can collect CMEs for participating today. A survey is sent out after the session. Complete one survey for each session that you attend, and you can continue to use that same link. Finally, we hope that you'll join us for our next ECHO session scheduled for 9 o'clock tomorrow morning with Dr. Gavin McGregor-Skinner, who's going to discuss the top 5 questions and calls being received during the COVID-19 pandemic. So please continue to watch your email for full information on upcoming sessions for the next week. Thank you, everyone.